that the form of fungus was growing on its area. Then he noted that definitely there must be a substance that is being secreted by this fungus, which is killing the bacteria, and he called it antibiotic, because that was the first history that we have penicillin, and it was actually from an organism called Penicillium notatum. Now, historians have gone back to records and traced that antimicrobial resistance has existed for a very long time, even before the history of antimicrobial resistance. That is why they are saying that antimicrobial resistance predates the history of antimicrobial use, because antimicrobial resistance is something that happens in nature. So you don't need, it's a natural phenomenon that occurs due to presence, because most of these organisms have been interacting in nature for thousands or millions of years, and we just recently started discovering them and using them. Those of you that have an old grandfather will have noticed that most of them have not witnessed the area of antibiotic, except if you are the Gen X who are much younger than us. But some of us, our grandfathers, have not witnessed the use of antibiotics except in the later part of their years. Now, why is it important to discuss antimicrobial resistance, AMR? If we do not discuss it now, we are going to have a devastating impact on the whole world as we know it. Antibiotics has changed the history of the earth. And if we don't take any concerted effort, we are going to enter into a troubling situation that no one can control. And next slide, please. Most of the discussion around antibiotics is being emphasized based on antibacterial resistance, because hardly do you see people discussing about other forms of resistance apart from antibacterial resistance, even though the others exist. And if I am to search your backpack or your purse for the females, I will be able to see some of you carrying antibiotics. But then why is it a problem to us? Because since 1980, with the exception of rifabutin, no new antibiotic has been developed, and almost all the antibiotics that we have with us have entered into one form of resistance or another. In fact, the World Health Organization made an estimate that 10 million people will die by the year 2050 without a global concerted action similar to what we did for HIV/AIDS and COVID-19. And it was because of this that this was a subject that was discussed at the 68th World Assembly, and it was also a topic of the United Nations General Assembly in the year 2018. Now, what we need to also look at history. Next slide, please. And go through history to see that the first case of penicillin resistance, penicillin use, the first case was in 1920s, and then we have the first case. Just a moment, please. Sorry, the first case of antibacterial resistance was actually, the first case of antibiotic use was in the early 20s. And then we have the first case of penicillin resistance that was discovered in Staphylococcus aureus bacteria in the early 40s. And since then, we kept on having issues with one antibiotic or another. They kept on developing resistance. In the 1950s, we have the discovery of other antibiotics apart from penicillin, such as the streptomycin, the tetracycline. But then around the same time, we have resistance developing to these novel antibiotics that were discovered. And in the 1960s, we have the first case of methicillin-resistant Staphylococcus aureus that was reported. When the methicillin was discovered, people thought that we have cured the issue of penicillin resistance, because now we have methicillin antibiotic, which was developed specifically to counter the effects of penicillinase. Subsequently, in the 1960s, vancomycin was developed, and it was thought to be the last antibiotic of this sort that can fight any sort of antibacterial, gram-positive antibacterial resistance. However, it didn't take any long time before we have antimicrobial resistance to vancomycin be reported. We need to understand that the 1980s to 1990s was a very important history of medicine, whereby we had human immunodeficiency virus pandemic that led to a lot of increase in opportunistic infection, just similar to what we have in COVID. It led to a lot of reversal of the gains that we had made in the history of medicine. COVID-19 led to reversal of the gains we have made in a lot of health-related issues, especially issues that had to do with immunization. Now, this was a similar issue that was done by HIV at that time. How many of you were born around that time? 1990s. Sorry, can you hear me?
Yes, sir. Very, very clear, sir. So I've stopped hearing you from my own end, sir.
Tuberculosis is beyond that. It can go ahead to infect almost any organ system of the body as we know it. Now, there were drugs that have been invented to be used to treat against tuberculosis, and these drugs are rifampicin, isoniazid, ethambutol, and parazinamide. Unfortunately, we had resistance to rifampicin and parazina and ethambutol, and that is once a bacilli, tuberculous bacilli, is resistant to those two drugs, we call it as multi-drug resistant tuberculosis. But then once the resistance extends beyond rifampicin and isoniazid to involve ethambutol or any of the second line injectables, including the fluoroquinolones, we call it the extensive drug resistant tuberculosis. And it is a real problem because we were at the verge of eradicating tuberculosis off the face of the earth when we had this extreme drug resistant tuberculosis reported in the 1990s. We have this carbapenem that was developed as the antibiotic of last resort for gram-negative infections, which are called the Enterobacteriaceae. But then in the early 2000s, we have the first case of carbapenem-resistant Enterobacteriaceae be reported. And then there was an antibiotic that had been in use for a very long time, known as colistin or polymyxins. And around the same time, around 2010, it was discovered that even these carbapenem-resistant Enterobacteriaceae have also acquired the resistance to colistin, and we call them the colistin-resistant Enterobacteriaceae. In the end, it means that there is no effective antibacterial or antifungal agent that is in the market now that we do not have bacteria that is resistant to it. And it was because of that that the World Health Organization declared antimicrobial resistance as a global threat in the year 2010. Now, it is enough of history, and it is important for me to look at etiology, what causes antimicrobial resistance. Misuse, overuse, inappropriate use, and underuse are the number one cause. You have been given an antibiotic, instead of you to take it in the prescribed manner, you end up taking inadequate sum. And what you end up doing is you are just challenging the bacteria to develop resistance, and by understanding how the antibiotic works and overcoming the mechanism of its action. Now, when you use too much of it, a similar thing happens because you are creating selective pressure in the cell and also prompting the microorganism to manufacture ways of evading this this resistance to this pathogen. In a similar vein, inadequate use is also referring to the same thing. Now, any of you that is traveling through any commercial motor park, you will have seen patient medicine vendors selling all sorts of antibiotics on their head, which is not supposed to be so. Additionally, pharmaceutical industries have taken up to the market. They are producing antibiotics and they are marketing it in an inappropriate manner. Go to any TV commercials, you see pharmaceutical industries marketing antibiotics, which is not obtainable in other countries. They even give incentives to some of our young doctors and some of our young health professionals that if you prescribe so antibiotics, we are going to give you so reward. It's when as bad as that, it means we are increasing, we'll keep on increasing the pressure. And as I mentioned to you, if I look at your backpack, definitely some of you will have 1 or 2 antibiotics in your backpack. And if it's the females, you will see it in your purse. You are just taking antibiotic as if it is a cake or sweet. And those of you that are into agriculture or rearing animals, they use a lot of antibiotics in these farm animals. And because these farm animals have microorganisms, they end up getting resistance, which can easily be passed on to human beings. And that is why it is a danger to use antibiotics either in farming or among farm animals. Next slide. It is important for us to look at the origin of drug resistance. Have a look at the possible causes. There are 2 bases when we look at how does AMR originates. We either have the genetic basis or the non-genetic basis. By genetic basis, by non-genetic basis, we are referring to situations that can occur that has nothing to do with plasmid or transfer of microorganism gene from one person to another, but rather we are referring to how bacteria can usually be walled off in an abscess. Next slide. Sometimes they say pus in, pus out. You know, they say pus in, pus out, because if you have an abscess cavity, no matter the amount of antibiotics you are going to use, this drug will never penetrate that abscess and there will be an inapparent resistance. So that is why they say pus in, pus out. Additionally, okay. Sorry for the brief interruption. So bacteria can also be in a resting state. Now, if bacteria is in a resting state, no matter the amount of antibiotic you use, you will not be able to evoke killing because they have to be dividing for them to be killed. Additionally, the organism that are ordinarily sensitive to any antibiotic can lose their cell wall because you have use an inappropriate dosage. And insect, sometimes you have a foreign body to have an insect that is being passed to aid urination, so that no matter the amount of antibiotic you use, it will not reach them. And this is what we call. Next slide, please. Can you hear me?
Yes, sir. Yeah, we can hear you, sir. You are audible.
Thank you. Now, chromosome and plasmid and all these here, they are just basic materials that can jump from one organism to another. Now, in this condition, once a microbe acquire a resistance, it can use it and transfer it from one form to another. Now, this mechanism of drug resistance are basically four. Next slide, please. Now, a microbe can develop resistance using four methods, either to decrease permeability, or to modify target, or to produce enzyme, or to have an active efflux form. Now, normally when I take lectures for my students, this is how I describe it to them. Assuming you have a troublesome person that is entering your classroom to disturb you, what will you do to him? You can do any of these four methods. The first one, you can decrease permeability. How do you do it? This is the cell of the microorganism. What they do to decrease permeability is to create a gateway to allow only certain microbes, only certain drugs to pass through, while allowing other drugs not to pass through. For example, if the drug targeting the microorganism is large, they can create a sort of sieve so that they don't allow large molecular weight compounds to pass through. So this is one component of decreasing permeability. So it's similarly in your classroom, you can create a gateman and tell him that only student of Usman Danfodio should be allowed access. Only person that have shown ID card should be allowed entrance. So this is one way to decrease permeability. Another way to decrease permeability is to modify your target. You all have classrooms and you have doors. So you can create or change your padlock so that nobody without the appropriate key could have access to enter. Another way is to produce enzyme and destroy the antibiotic once it has entered the cell of the microorganism. How do they do that? How do you do that? Once somebody enter your room, you can start raining abuses on him and telling him to go out. So this is my own way of how I remember them. And the active efflux, we can look at a giant in the classroom and ask him to carry him up and throw him away. So these are the same mechanisms that this microorganism utilize to handle issues around antimicrobial resistance. Now let's look at the consequences. The consequences can be to the individual, to his community, to his family, to the healthcare facility, to the economy, to the government. The consequences are numerous to be mentioned. You can have a serious infection that is difficult to treat or even impossible to treat. That's a very bad consequence. It can lead to a prolonged stay in your hospital, very difficult for you to get well. It can increase your medication cost and it can even lead to death. It can also have other impacts in the community. We keep on having outbreak of infectious diseases due to antimicrobial resistance. Sometimes you just went to the restaurant and you eat, you come down with infection, which are also difficult to treat, unlike before that we can just use a single treatment for management. Additionally, we can have, it can lead to increased healthcare costs and also reduce productivity. So these are all consequences that can affect, that can result as a result of having antimicrobial resistance. Now let's look at the holistic approach. How do we address this threat of AMR? Having defined it, having looked at the history, having looked at how it happens, and then having looked at the mechanism. Now, how do we approach it? The best way to do it is we should create sensitization talks similar to what you are doing now. And that is why I must salute your courage for what you are doing to reduce the overuse and misuse of antimicrobial agents. We should take this campaign to the community. We should involve the community pharmacists, the part-time medicine vendors, sensitize community, do radio shows, do television, create drama points so that you sensitize people about the impact of antimicrobial resistance. The government should invest in research and development so that we develop new drugs. We should also try and improve on our infection and prevention measures, to improve on hand washing hygienes, to improve people should always wash their hands so that if they carry the microbe, they will not transmit it to another person. You should always use gloves if you are in the hospital setting. Even if it is not a hospital setting, you should ensure that you are using gloves. We should raise awareness among healthcare professionals, among general public. That is why we are having this youth action against antimicrobial agents. So you should be an antibiotic champion, anti-AMR champion. You should fight against AMR. These are all measures that you can do. In the next slide, I have given additional ways that you can advance the work against AMR. You need to learn more. There are a lot of webinars, online courses that you can do. So please register and do them so that you know about AMR, you know the consequences, and you know how best to prevent against it. You should also use antimicrobial drugs responsibly. A lot of you, when you have catarrh, 80% to 90% are caused by viral infection. You don't need antibiotic. But how many of you will have catarrh and will not take antimicrobials? Very few of you. So when you have catarrh, don't take antibiotics. Rather, just take pepper soup. Research has shown that you don't need antibiotics because they are virus. So you should use antibiotics responsibly. The females among you will know that if they use antibiotics for more than 10 days, they come down with severe infection, sometimes even increased vaginal discharge and the rest. So you should also be advocates for infection prevention and control. Infection prevention and control is another very big area or topic in microbiology, and you should also look at it up. You should also be able to educate others about the consequences of AMR. In conclusion, I want to reiterate that AMR is a global threat to public health, and it can have devastating consequences on individuals, community, and economy. And we need to have a holistic approach to address it. You all can play a role in addressing this threat. This is just a call to action, and you are encouraged to learn more about AMR and to also use antimicrobial drugs responsibly. Next slide. Next slide. You are encouraged to use antimicrobial drugs responsibly. And with this, I have come to the end of my presentation. Remember, it's not a lecture, it's rather just a presentation session. And I will seek your permission to change from this phone to another phone so that I can conserve my battery. So just give me 2 minutes, I will come back for discussion session. Thank you.